Hi guys, sorry this is late and we're not in Congenital Heart Week, but we're still in Heart Month, so yeah, better late than never. This video is about the most annoying things that the health profession say to people with congenital heart diseases. A lot of other congenital heart patients have been asked these questions by the health professional. So the first question that I get asked that really grates on me is, oh my goodness, your SATs are low, are you feeling okay? Now SATs mean saturation of oxygen in your body. A normal person's SATs sit about 99%. My SATs sit anywhere above 80%, 80 to 86, in that range. So it's quite a big range mine sit in. So when I say this annoys me, it's not when I turn up at A&E and they take that and they panic and they get the oxygen. That's fine because they don't know at A&E. You know, they're not congenital heart disease specialists. And so I'm going to give them a little, they're allowed to have that one. Where it really annoys me is when I turn up at my specialist congenital heart clinic with the congenital heart team. So you're thinking, these guys are going to know a bit about what they're talking about. Anyway, the nurse takes you through, plugs you onto the machine, looks at you, looks away, looks at you again, takes the machine off, puts it on another finger, and I don't tell them because I think, no, you should know your job. Anyway, they start kind of getting that bit antsy-pantsy, and then they ask, oh, your SATs are quite low, is 82 normal for you? Now, that's fine because I can say, yes, that's normal, don't worry about it, that's quite good. If I didn't know my SATs, like if I was a congenital heart patient, and there are a lot of us who don't know their specific numbers and their specific what's normal for them, and this is why I have to learn all that stuff, because I used to panic and I used to think, oh my god, there's something wrong with me. Do I need oxygen? Am I dying? Why is this nurse totally freaking out in front of me? So this is a heads up to you nurses at the congenital clinics. Just take the readings, don't say anything, don't look flustered, and if there is something that really does concern you, don't show that in front of the patient. Let the patient go back to their seat or whatever and then go and check it out with a consultant, because as patients we have very high anxiety, health anxiety anyway, so these little things adding on to it, you're like, oh my goodness, maybe there is something going on. So please, don't do that. Number 2, and this was asked of me a lot last year from nurses on the ward. The ward was a respiratory ward, and they probably didn't really know the ins and outs of everything that was going on with me, so I'll let them off as well. But it did start to annoy me after they kept asking me. So the question they kept asking me was, oh, can they not just transplant you? In theory, that would be brilliant. Take out my heart and lungs and pop in a new one. But there's a lot of stuff that goes along with transplantation. It's not a cure, it's not a fix. You're just trading one disease for another. And I'm going to be having a lot of these discussions with my doctors soon. So I'm not going to go into depth of this because I'm going to do some more videos about this in the future. But that really annoys me when people just, especially medical people, just presume, oh, just have a transplant and you'll be fine. That would be great. But as I say, there's a lot that goes along with that. And yeah, so I'm going to be doing some videos about that in the future, because as I say, I'm going to be having a lot of them talks with doctors soon. Now, kind of on that one, but I've not experienced it because I've not had a fix, I've not had any operations. I say fix in a very loose term there, sorry, I meant to say I haven't had any childhood operations to patch up whatever's going on. But I know a lot of congenital heart patients who have had operations and have been asked by medical professionals, doctors, nurses, whatever, oh, but aren't you fixed? No. What actually happens is no one's ever fixed. If you have surgery as a child, that's fantastic and it gives you a better quality and maybe length of life, but it's not a fix, because when you get older, other things are going to start coming into play. And this is where a lot of people are lost in the system. They've been told as children they've been fixed, go away, and then something else happens later on in life, arrhythmias start, and they have to go back and try and get back into the whole system again. So there is never ever a fix for congenital heart disease. There is operations that help to patch it up, palliative operations that give you longer lives, more better quality of lives, but you're never ever fixed. And that's the same thing with a transplant. It is not fixing you. It's not fixing the problem. The next one is, and I get asked this a lot and it really, really grates on me. So, congenital heart disease, how long have you had that? Okay, if someone who's not medically trained asks me that, that's fine, because they might not know what the word congenital means. But congenital means from birth. And I just think anyone medically trained should know congenital means from birth. Hence, I've had it from birth. And yeah, it is really, really frustrating when people ask you that. And I'm just like, are you a doctor or what? And the last thing that grates on me being asked by someone from the medical profession is, and it's, yeah, so first of all, oh, do you have any children? And second of all, oh, are you planning on having any children? Please don't ask that. You know, it's a very personal question for anybody. But for someone with congenital heart and lung disease, and I do understand there are women who have gone on and had children, and that's fantastic, but not everybody's the same, and you can't just presume that we are. And if they had actually read my notes before they asked me that, they definitely would not be asking me that question. So thanks for listening, guys. As always, have a good day, and we'll see you later.